Our public health analyst, Yemisi Soyombo, is in Lagos, and she is joining us via Skype to discuss what we see about the latest COVID-19 figures around the world. Of course, it's good to have you join us on the news at this time. The latest wave of new cases and COVID-19 infections in the U.S. must be troubling, for the American public. But what would you say is responsible for this surge? Only days ago, we saw the same scenario in the United Kingdom.
Hi, good afternoon. Thanks for having me. Can you hear me?
Of course I can hear you. I'm asking you that we've seen this same scenario in the United Kingdom. I'm asking you, what do you think is responsible for the surge that we see in the United States already? There, according to the projections, we already see 200,000 deaths just as yesterday, and then today. Let's talk to us about what you think is responsible for the surge.
Yeah, I think I would say also that the trend is worrisome. The increase, the figures we're getting all around the world is worrisome. As to why there's an increase, I think it goes back to a lot of people who think it's still a hoax. The mentality of how the country is managing it, the mentality of the citizens themselves. Every now and then you see videos all over the place trending as to how one person or the other in that geographical location believes that the COVID is not real and they shouldn't protect themselves. So I feel like as long as we all don't take it as a team, as long as they don't take it seriously, as long as they don't adhere to all the guidelines that have been given for prevention, the tendency that there will be an increase, or this increase we're seeing, is what is real, because it will keep spreading and it will keep increasing. Some degree of research also says that the weather, the fact that in that geographical location, America, for instance, they're going towards the winter season. The winter season creates more exposure to cold, to flu, and then the COVID-19 is synonymous with flu. So there's fear. There's really fear that there's going to be more marked increase in new cases of COVID-19 in America.
Of course, pretty interesting and troubling at the same time. The American case, because of the current data, shows the increase in states including North Dakota and Utah. What exactly would you say are possible challenges, of course, in the way the virus has been managed by the U.S.?
Working with data that we're seeing, I think we just all have to stick to guidelines, meaning social distancing and masking. Whichever state, all over the U.S., they have to stick to social distancing and masking, because data is also showing that, unfortunately, COVID-19 has become one of the highest diseases to kill people next to hypertension or heart diseases. So, they just have to go back to status quo. They just have to go back to all the measures, all the preliminary measures, all the masking, all the social distancing. Everybody has to be everybody's responsibility now. And the lackadaisical attitude we've seen to some extent of managing the virus or from people has to stop, has to end.
A lot of persons would blame it on the U.S. government. Well, President Donald Trump has referred to the new figures as a horrible thing from his last conversation with newsmen. He also blamed China for not doing enough early. But one would think that 9 months after the first case was reported, this sort of blame game should not arise.
Yeah. It's true. Information has come that the virus came in from China, but the U.S. is not the only country the virus went into. So I think that's where I talked about the lackadaisical attitude. I probably wanted to choose my words by not blaming it on the government, but there's a lot of lackadaisical attitude. There's a lot of blame gaming. When there's a problem, that's where responsibility comes in. You take responsibility for what has happened. Like you said earlier, 9 months down the line, we shouldn't still be reiterating to the fact that this virus came from China. Right now, it's here. What should we do? What measures should we take as a country, as a whole country? The figures are really alarming and worrisome, I must say, really alarming. So China shouldn't be blamed. China shouldn't be the main point of conversation as it is now. I think the more conversation should be prevention. More conversation should be what they should do, what standards should be kept. And I hope, like everyone has said, that the vaccines would come in fast. The vaccines are to come in, say, about 3-4 months down the line, according to speculation. But that would be one of the solutions. Hopefully, the vaccine should come in as fast as has been speculated, and then this should curb the virus to a large extent as well.
Of course, talking about the race for a vaccine, there are varying projections as to when a definitive vaccine will come through. Perhaps this would close the chapter on the virus once and for all. Do you share that line of thought?
Yeah, I share that line of thought, not just for America, but like on the international space, for the whole world at large. So I know that there are various fears as to the vaccine, the side effects of the vaccine and all of that. But apart from the measures, the prevention measures we have in place now, which is going back to masking or social distancing, the vaccine is the next point of solution we're all looking at as the whole world. We're all looking towards the vaccine coming in as speculated. And like I said, this should put almost like over a 50% end to the increase in COVID-19 cases coming in all over the world.
Of course, some persons, there's a discussion ongoing about the fact that some persons may not subscribe to taking a vaccine to prevent themselves from contacting the virus. But are fears of a global second wave justified? We're watching a scenario in the United Kingdom and in other parts of the world.
Sorry, I didn't get the
I'm saying that if you look at the scenarios that we've seen in the United Kingdom and the United States, do you fear that there could be a second wave, of a possible lockdown in countries around the world?
Maybe not all over the world, but I fear that there could be a second wave. Now, even coming to all over the world, it should also be a fear for the rest of the world, especially since most immigration laws the restrictions have been eased as to traveling from country to country. So if this is not curtailed, say in the US, not curtailed in the UK, and the numbers keep rising, the tendency that there might be a huge second wave all over the world is high. So I fear for that second wave, and not just for America or for the UK. As long as the borders are open, it might just keep spreading back and forth. That is, if the vaccines don't come in time, or if we don't accept the vaccines as we should.
Public Health Analyst Yemisi Soyombo, thank you so much for sharing your thoughts on the news.
Thank you for having me.